Have you got pain in your forefoot or burning or tingling under the balls of your feet here? If so, then this video is for you. I'm Andrew Wynd, Foot and Ankle Physio. We're going to go through what is a Morton'sneuroma, which is the most common cause for forefoot pain around here. In this video, I'm going to show you how to work out whether it's that or something else. And most importantly, I'm going to show you our top 5 tips that don't involve surgery to try and address this yourself. And I'm going to include a bonus tip at the end, so make sure you watch along to the last one. All right, let's get into it. So what is a Morton'sneuroma? A Morton'sneuroma is a growth around a nerve in the foot. Typically, it affects the space between the 3rd and 4th toe here, okay, because the nerves run along here in between the metatarsals. If we have a look here at our anatomical model, we've got the metatarsals here, these long bones, and in between we've got the interdigital nerves. Now the most common site is right along here, so typically underneath here, and that will refer and cause pain under this part of the foot here. And in this particular patient I've got here today, they do have a Morton'sneuroma and they've got discomfort right underneath here. Now on this particular foot, and I'll show you in a second, it's not in that 3rd intermetatarsal space, it's in the 2nd. This is the 2nd most common site of a neuroma. So the name neuroma sounds a little scary, but importantly, it's not a nasty issue with a nerve. It's where the nerve has become thickened, and it's a benign sort of growth, and it's thought to be largely due to compression inwards on the metatarsal heads here, and also from shearing force in the particular space between the metatarsals. This will make more sense to you as you watch along in this video. Now, if you do have forefoot pain, sure, it's most likely it's going to be a Morton'sneuroma. However, there are some other things that it could be. These include bursitis, stress fracture of the bone or a bone issue along the metatarsals. Freiberg's disease can also manifest as that. And these are all really important things that you need to go and get checked out. So I'll share as many tips as I can to help you. It's really important you get a professional medical diagnosis because those other things do require slightly different treatment. Now let's assume that it is a Morton'sneuroma, and you're not alone. It's thought that potentially 20 to even 30% of the population at any given time will experience a neuroma in the foot and get ball of the foot pain. Typically, patients will present and talk about like a stone feeling underneath the ball of their foot, or even like their sock is crinkled underneath their forefoot or toe. So those are the most common typical things that patients say, and you might have experienced that yourself as well. Some big names have also had this. A lot of high heel wearers will get Morton'sneuroma, and there's a bit of a clue there in the footwear. Also, professional tennis players, Milos Raonic from Canada, and someone I saw here, the Australian big server Sam Groth, also had a lot of issues with Morton'sneuroma, and we had to really go through a lot of different shoes to get Sam's issue sorted, which ended up actually having surgery. Now on to the diagnosis. So what you're going to want to do is what's called the squeeze test. And if you come in close here, you'll see the difference here. So if I grab this foot and apply a compressive force in there, how does that feel? Okay. No pain, okay. And I can even feel that there's not a lot of resistance there. So no pain for the patient and no resistance there. Now on this side, if we push here, how does that feel? A little bit sore. Okay. And where is it sore? Is it somewhere underneath here, somewhere in here, deep? Yeah. So that's exactly what's going on. This left foot is we do have a neuroma on this side and not on this side. That's the squeeze test. It's a great test. It's really, really sensitive. Now what that means is if it's inflamed or there's any issue there, it will pick it up. But it's not a very specific test. So what that means is the other structures that could be causing issues in there, we can't really differentiate between one or the other. So if you have a positive squeeze test, chances are you've got an issue in the forefoot. Most likely it's going to be Morton'sneuroma. Again, make sure you get that checked out. Okay, so let's get into it. If you've got this issue, how can we fix it? I've got 5 top tips that we use here in the clinic. I'm going to show you with this real life example of the foot. Tip number 1, footwear. We talked earlier about high heels and how the incidence of neuroma is really, really common in high heels. Well, compressive shoes that are really too narrow and squash the toes cause all sorts of issues, and you can quite easily see how this would cause constriction around that nerve. So it's really important, tip number one, that you avoid narrow shoes. What I've got here is a really cool brand called Feelgrounds. Their mission is to create wide barefoot style shoes that look cool as well. Whether you think that shoe looks cool or not will be up to you. But what you can really see there in the forefoot is that it's really, really nice and broad. So there's certainly not going to be any compression from this particular shoe. So a wide toe style shoe. One quick tip there, watch out for. If you are going to go a barefoot shoe, the forefoot's great and you will have width there. However, there's not a lot of padding underneath here. And if you're sensitive around the balls of the feet, choose a shoe that has a little bit more padding underneath it. I'll link in the show notes and in the description. We love the brand Ultra and Topo, for example, and I'll link to them because they've got a wide forefoot and some cushioning underneath the balls of the feet. All right, that's tip number one. So tip number two is to explore the calf, in particular the length of the calf. And here's a quick clinical test you can do, and I'll demonstrate for you. On this side, I'm going to straighten the knee and see how far I can get that ankle up, okay? And as you can see, I can't get it much past vertical on this particular side, which is the symptomatic one. Let's have a look on this side. So the same thing, I'll lift up. And I'm not sure if you can see that as clearly as I can. There's much more give or flexibility range of motion in there. So how is that important? If the calf muscle is tight, and I'll use this to demonstrate, as we walk, and the tibia comes forwards over the foot. If the calf muscle is restricted there, you won't get enough forwards movement. Then the typical pattern is to slightly twist the foot out and pronate the foot. And then that will cause shearing through the forefoot. And you now know that shearing is one of the leading causes alongside compression as to what causes a Morton'sneuroma in the first place. So you need to stretch the calf out. How do we do that? Well, you need to loosen off any tightness through there. You can quite easily massage the calf. You can use a massage gun. Perhaps one of the easiest ways to get some length and release in the calf is to use a foam roller. At home, typically we'll get our patients on the ground, supporting themselves and using this foam roller underneath here. It's a bit awkward up on the treatment table, but you'll see for effect there. If you cross that leg over there, you get even more pressure, and we roll backwards and forwards, and there's probably some really tight spots in there in that muscle. Great. I recommend 5 to 10 minutes every single day. It will be a little bit sore at the start, but it loosens off quite quickly after 1 or 2 weeks. So chip away at a foam roller exercise as well. That's tip number 2. Tip number 3 is massage, but not at the calf this time, down at the actual foot. Remember we talked about the issue being compression and shear force. We want to create some space around the neuroma. I'm using a massage cream. This is a high quality one from Premax, but you can use anything you have available. Now, massaging on top and on the bottom of the foot is a really important component of self-treatment. Importantly, if the neuroma is really, really tender, then you won't want to press right on it. It doesn't like compression. So if you find a really sore spot in between the metatarsals, that gives any sort of sensory or tingling or underneath, you're typically going to be right on top of that neuroma. Just avoid that, go either above or below it. I'll show you on the bottom side first. Working our way with the fingers up through here, you'll see that I'm massaging in between the metatarsals. I'm going through the 3 layers of muscles in the feet, and you'll find some tight spots in there more than likely. It's also important to massage on the top of the foot. Now there's a lot less padding in here, so you'll need to find the bones themselves. We don't want to press on them, and you want to find the gaps in between the metatarsals. Okay, so there's bone here, gap here, bone again, gap here, and you'll find, particularly there, quite sore and tight, and that's where I can actually feel compression. The neuroma is likely to be down here, but so I'm above it and I'm opening up and creating some space there. Same as down here below it, and there's no issues in through that first space. So massage on top of the foot and on the bottom of the foot. If your thumbs get sore, that's why we use these tools. This is a lacrosse or massage ball that you can use underneath. Works really, really well to generally loosen off the whole area and decompress the foot. You want to roll the ball backwards and forwards like so, not right on the balls of the feet. That's important because they're sensitive structures. We want to be behind it, backwards and forwards like so. It's also helpful to go side to side, as you now understand that will decompress and create space between the metatarsals. Fantastic. Now, this one here is for on top. Exactly like we used our thumbs. Sometimes my thumbs don't even fit into that space between the metatarsals, and that's where we use this foot mobilizer. And we can find the tight spots in here and work into, that's probably quite tender again in there. Okay, so not too hard the first go. It will loosen up. That's tip number 3, massage top and bottom. How are we going so far? There's still a couple more tips to go, including the bonus one. If you're liking this content, don't forget to give us a thumbs up. It means that you're valuing what we're doing, and I'll keep producing content like this for you. Tip number 4. This is a common one. You'll see this pop into podiatry clinics around the world. This is a metatarsal dome. This is my favorite one. It's got a bit of give in it. And I'm going to show you exactly how this works. If we put it underneath here, just behind the metatarsal heads, when you're weight bearing and pushing up on here, you can see what's going to happen. If you see on the top, it will lift and spread those metatarsals apart. So you can quite easily see that that's going to relieve some pressure in there as well. So you can glue this onto the insole of your shoe or an orthotic or insert. However, my most important tip with it is, whatever you do, if you put this in, do not put it too far down the foot. I see this mistake all the time. It actually makes the neuroma pain worse, and it's placed too far down and compresses the metatarsal heads. That's a big no-no. So if anything, put it a little bit further back towards the heel. That's an important tip for you. Okay, tip number 5. This is an easy one, toe spacers. Full disclosure, this is a Flamingo feet product. This is my product. This is one of the reasons why we designed this. Watch what happens when we put toe spreaders on. As the name suggests, when we put these on and pull them down into the right position, you can see, and the name is a giveaway, they are toe spacers. They create space between the toes. I'm constantly stunned at how quickly these will relieve neuroma pain. Obviously, you can see the gaps now between the toes. That will immediately decompress the entire metatarsals and create some much needed space around that neuroma. So typically start 10 minutes a day with these and then gradually build up your wear time for a few hours. And that, in conjunction with the other tips I've already given you, will make a big difference. All right, now the bonus tip that I promised you at the end. Thanks for watching to this point. Remember how we said at the start of this video that compression and shear force is what causes this? Well, watch out for this one. This is a tricky one that's often overlooked with Morton'sneuroma. When you pronate, when you roll in, your foot is naturally wanting to shear a little bit. So if I use my model here, when we pronate and roll in, and it's quite tricky to demonstrate, but hopefully you can see, the arch drops, the lateral part of the foot comes rearwards, and this part moves forwards, which creates a shear force through the forefoot here. So we want to examine the rate and degree of pronation, which we'll typically do in a walking exercise, but let's have a look at how strong this particular patient's muscle is in tibialis posterior. Now this is the muscle that controls pronation. Let's check it out. So if we point down here and then turn inwards, good. Now your job is to hold me, okay, as hard as you can there. So we're just going to do a manual muscle test there. Okay, now I can overcome the strength of that fairly easily, which in a young, healthy female who's very active, they should be able to easily beat me. Let's see what the other side looks like. Okay, so same thing on this side. I'm going to get you to point your ankle down and turn in. Good, and hold. Don't let me pull you out. So I'm trying really hard there and I cannot beat that foot. That is a quick, more normal, I would say, level of strength. Quick test, and so we know that we're weak here, which it's no coincidence that we're having issues on this particular side. So how do we fix that? We use a strength band. We put it around the toe, just behind the big toe joint here, pointing the foot down. And then what I'm going to get this patient to do is turn in, just like that. Thank you. Perfect. Good. Let it come out and in again, right across. Sweep that foot across. Great. So if you can, keep the legs still. Good. Great. And pull it down as far across as you can. Can you take it in further? Can you take it in further? Perfect. Good. There's lots of different ways you can set that up. You can do it in sitting. You can do it in standing. There's a whole different opportunity there to strengthen in different positions. But we want to strengthen tibialis posterior. That's the key point. Well, there you have it. Hopefully those top 5 tips will really help you and your neuroma. And if there's any issues or you want to ask any other questions, make sure you pop in the discussion. Really appreciate you watching and supporting the channel, and keep the comments coming, and I'll keep delivering content for you. Thanks, guys.